The first time Lisa Carey threw a dart, she hit a bullseye. UNC Health and UNC School of Medicine may expect that same acumen from her as the executive director of their newly formed joint effort, Clinical Research Partners, to coordinate clinical trials in all fields of medicine and make it easier for patients in rural hospitals to participate. Carey's abilities and work ethic have shown themselves throughout her career, first at Wellesley College as an undergrad, then at Johns Hopkins University School of Medicine, where she was intrigued by oncology, a field where science was being translated into medicine at a fast pace. She accepted a rigorous residency at Johns Hopkins and braced herself for treating cancer patients, fearing it would be depressing. Instead, she found the patients to be totally inspirational, she said, and recognized that she had found meaningful work. To better understand the science of the rapid advances in breast cancer treatment, Carey entered a fellowship in a laboratory and then got a master's in clinical research at Johns Hopkins. When she returned to clinical work, she had a better grasp of designing clinical trials that could determine next steps for treatment. Shelley Earp, who at the time was director of the UNC Lineberger Comprehensive Cancer Center, met Carey at a medical conference in the late 1990s and persuaded her to bring her talents to UNC, which then and now had a renowned breast cancer program.
One of the things that makes Lisa so successful is she's never satisfied with the status quo. She has this capacity to think about very fundamental causes and aberrations in breast cancer. She also has this practical side. If you design a clinical trial that can't be done, no one is helped.
In 2000, UNC recruited Chuck Peru, a renowned researcher who studies how genes implicated in breast cancer behave. He and Carey teamed up to become a formidable duo.
She can summarize things and clearly articulate complicated topics to an audience of experts and non-experts at the same time. She's, a very sought-after speaker, both at UNC and around the world. I've seen Lisa modify her talk that she's going to give to 1,000 people 5 minutes before she gives the talk, based on things she might have just heard from the previous few speakers.
In 2005, Carey was a founding member of the Translational Breast Cancer Research Consortium, a group of 18 specialized programs in research excellence that collaborate across the country. In 2009, she was invited to join NCI's Breast Cancer Steering Committee, which guides investment in research initiatives. For the past decade, she has co-chaired NCI's Alliance for Clinical Trials in Oncology, along with oncologist Ann Partridge, a professor at Harvard Medical School, and Eric P. Weiner, chair in breast cancer research at Dana-Farber Cancer Institute.
From the very beginning, Lisa has treated the work that we've done like a team sport. She's a star in that way. In the Alliance, Lisa and I have worked tirelessly to try to help to change the face of breast cancer. She's got a critical kind of laser focus on what's important and what's not so much.
Carey is the lead principal investigator on a $30 million federal grant to conduct a series of large, multi-year, innovative trials in metastatic breast cancer. She serves on a number of state and national boards and holds the L. Richardson and Marilyn Jacobs Pryor Distinguished Professorship for Breast Cancer Research at UNC and is Deputy Director of Clinical Sciences at Lineberger Comprehensive Cancer Center. She is also Director of Lineberger's Center for Triple-Negative Breast Cancer, which was created thanks to a $25 million donation.
Lisa is incredibly busy. She's doing big league administration. She's writing grants. She's handling large-scale clinical trials. She's somebody that almost everybody in the world wants on their podium to talk.
Because UNC is a public hospital, Carey cares for women from all walks of life. She has been recognized for her work to reduce disparate breast cancer outcomes, especially among Black women. As Executive Director of Clinical Research Partners, she'll expand access to clinical research and innovations for people across the healthcare system, including in rural areas.
Lisa is a true champion for both her faculty at UNC as well as our faculty around the country that we support. And I've always admired her ability to really support people to do their best work.
Carey devotes similar support and encouragement to her family. She and her husband, neurosurgeon Matt Ewand, have raised 3 children. Carey often rides her bike to work and was able to pedal to the kids' school to participate in their activities. Though she and Ewan didn't make it to every soccer game, their children grew up with a deep sense of mission-driven work.
I have no idea how Lisa can be a national figure on everybody's guidelines all over the world to how to treat breast cancer, bring in millions and millions of dollars in research grants, and yet raise 3 beautiful children. And she's just taken on a new role for the entire healthcare system to run a clinical research program, including cancer, but beyond that, to really bring, for the first time, the School of Medicine and UNC Health together. And it's not a surprise that they have tapped Lisa to do that, because she has proven over and over again that she has the people skills and the administrative skills in addition to the research skills. So she's highly respected, but she also gets things done.